Hello, I'm Dr. Gillman. I have received my education from Stanford University and orthopedic surgery training from Harvard and Tufts University faculty. It is my great pleasure to be here and with you to help you understand what is involved with a knee replacement and hip replacement. It is my great honor to help organize, and to bring the best of the best surgeons from the United States to perform knee and hip replacements in Dubai and UAE. The surgeons that we have participating in this program run joint replacement programs at Columbia University, Stanford University, New York University, and other prestigious places. We today are going to try to help inform you about knee replacement and hip replacement so that we can help to get you through your surgery and doing well after. What is the best thing that you can do on your own before having a hip or a knee replacement surgery? The best thing that you can do is to be on a regular exercise program. You may have difficulty walking. Usually the best exercises when you have a knee problem or a hip problem are riding a bike or stationary bicycle, swimming. We try to encourage people to have 30 minutes at least, up to 90 minutes a day of exercise. And we like to tell our patients that you should try to train as if you're training for a race or competition. The more exercise that you can do and the better strength that you can get in your legs, the easier that your recovery will be after having had a knee or a hip replacement surgery. What will it be like when we see the doctor before surgery? We like to have you see a medical doctor between 30 days before the surgery and up to 90 days before the surgery. When you have a visit with the doctor, they will perform a complete examination. They will order x-rays of your spine, your lower back, your hips, your knees, and legs. We will perform CT scans. This allows us to confirm that the surgery being proposed will be all that is necessary for you to get better, and it helps to plan for the surgery, for the surgeon to be able to put in your artificial hip in the best way or your artificial knee in the best way. If you have any heart problems, it is very important that you let your doctor know, and we may need you to see a cardiologist or heart specialist before having the surgery to be sure that your condition is in top shape. If you have diabetes, it may be necessary for you to be seen more than once and to have your blood sugar controlled. We would like for you to have your hemoglobin A1C level below the number 8. That way we have a lower chance of having infection or other problems. If you smoke or use tobacco, it's very important that you stop this before the surgery, ideally 30 days before. This really makes a big difference in reducing the chance of having a wound healing problem or an infection. An infection after a hip or a knee replacement is very serious. It does not happen very often, about 1 out of every 200. But if you have an infection that develops, it requires 2 surgeries and up to 6 months where you're not walking. If you are high weight and your body mass index is above 40, we will have you work with doctors to try to lose weight. If you are overweight, it is best to have a hip or a knee replacement when your weight is low. This makes your recovery faster. If you have a kidney problem, it may be necessary for you to see a specialist before the surgery to make sure that it is safe. If you have any problems with your breathing, it may be necessary for you to see a pulmonary breathing specialist before the surgery to make sure that we are safe to have the surgery. The night before the surgery, please do not eat or drink anything 9 hours or less before the surgery. It is dangerous if you have anything in your stomach. There is a problem with the anesthesia called an aspiration, which can be a very serious problem. So we ask that you not have anything to eat or drink, no coffee, gum, or anything. If you take medicines before surgery, we usually recommend that you take them in the morning with just a very small sip of water. The exception is if you are diabetic, please ask your doctor before the surgery if you should take your diabetic medicine before the surgery. What type of anesthesia will you have with surgery? 90% of the time, we give patients a spinal anesthesia where you will not feel anything below your legs. Because the surgery is loud and we use instruments that make noise, we will give you, through an intravenous in your arm, medicine so that you will be asleep and not aware of what we are doing during the surgery. Sometimes, about 10% of the time, it's necessary to have a general anesthesia if we are unable to get a proper spinal anesthesia. In addition, for knee replacement patients, you will receive an adductor canal block in your hip area. This is numbing medicine that the anesthesia doctor will place so that your pain will be much less after the surgery. What type of implants will be placed into me when I have a hip or a knee replacement? There are 4 large global companies that have hip and knee replacements. All of the surgeons in this program use the highest quality from Stryker, Zimmer Biomet, DePuy, and Smith & Nephew. There are minor differences between these, but they are all highly reliable, and the type of implant that is put in should not be a concern. What is the success of joint replacement surgery? Hip replacement surgery is about 97% successful. There are low risks, but some of the risks of hip replacement include about a 1 in 200 chance of getting an infection, about a 1% chance of getting a blood clot in your legs, about a 1 in 500 chance that a blood clot in your legs could become an embolism. Blood clots, we usually will have you taking aspirin after the surgery for up to 6 weeks' time. If you are higher risk, then sometimes we will provide a different type of prescription medicine to prevent blood clots. What you can do after the surgery, whether you're having a hip or a knee replacement, it's very helpful to get up frequently during the day, every 1 to 2 hours, to walk and stand for a few minutes so that there's a lower chance of having a blood clot. Another risk of hip replacement, and it happens about 1 to 2% of the time, is a dislocation of the hip, where the hip can pop out of place. When you have your physical therapy after the surgery, they will show you which positions we should avoid for the first 6 weeks after the surgery. If you have a dislocation, it requires a minor second surgery to place the parts in a different position that is better for you. Knee replacement surgery is effective 85 to 90% of the time. Fractures of bones, nerve injury, blood vessel injury are not common after hip or knee replacement. They are possible, and it is important to realize that there can be serious complications from these surgeries. Sometimes we understand why patients continue to have pain, but sometimes we don't. The chances for success are very high with knee replacement surgery. One of the unique challenges with knee replacement surgery is having a stable knee replacement. At the time of surgery, your surgeon will see which is the best fit to make your knee sturdy and stable. Sometimes the ligaments can become loose, and it is not often but sometimes necessary to have a second knee replacement if your knee replacement is not stable. What can I expect in regards to pain after my knee or hip replacement surgery? Generally speaking, patients that have hip replacement take narcotic strong pain medicine for the first day or two, and then we use different medications for pain: Tylenol, anti-inflammatory medicine, aspirin. Knee replacement patients typically take strong pain medicine for 1 to 2 weeks after knee replacement. Rarely, strong pain medicine is necessary for several weeks, and even more rarely, for several months. It is really best not to use narcotic medications because of the side effects. So we'd like to try to get you off of any narcotic medication as soon as we can. You will feel better not taking narcotic medication, and you will be able to participate more in exercise and physical therapy, which is important after having both knee replacement and hip replacement. How long will my recovery last after hip and knee replacement surgery? Many patients are happy after the first several weeks, but there are patients that can take 6 months, rarely up to a year, to recover. It is important for you to try to stay focused on continuing with the exercises. It is sometimes easy to get frustrated if it is slow to recover, but almost all patients do very well, and I encourage you to stay positive with an optimistic outlook and to continue on the exercise program that the physical therapist will show you after the surgery. Will I need to have a blood transfusion after surgery? Blood transfusions are almost never necessary after knee replacement and only rarely necessary, less than 5% of the time, after hip replacement. We use a medicine called tranexamic acid in the last 10 years. This has really helped not needing to receive blood transfusion after knee or hip replacement surgery. After the surgery, for the first week, we encourage you to be drinking plenty of liquids. We recommend 250 milliliters, 8 ounces, every 1 to 2 hours during the day. If you are drinking well, you will be usually having to urinate every 1 to 2 hours. This is good because you will have more energy, you will have less dizziness, and it will help your recovery to be sure you are getting plenty to drink. What equipment will I need at home after the surgery? This is a breathing device called an incentive spirometer. We like patients during the day to take 10 slow, deep breaths to help expand your breathing and your lungs. This will reduce the chance of having some fever after the surgery. It's normal for about a week to have a low-grade fever after surgery. We usually recommend for 1 to 2 weeks after the surgery, when you walk, to use a walker. A walker allows for you to put your full weight on your leg, in most cases, with less pain. It also protects you from falling if you should happen to feel unsteady. After the first week or two, some patients use a single cane for a week or two. Some patients do not need any help with a walker or a cane after the first 1 to 2 weeks. An ice cooling unit is often very helpful after a knee replacement. We usually will recommend for 1 week, and some patients like using for up to 6 weeks ice or cooling for their knee. For hip replacements, we like to provide an elevated seat for the commode or toilet. This will make it easier for you to get on and off the toilet, and also make it less likely that your hip will pop out of place or dislocate. At home, it is a good idea to make sure that you have space to use a walker and that you have carpeting that is not going to move when you're walking and your footing is not as good for the first 1 to 2 weeks. What should I know about physical therapy and exercises at home after the surgery? We usually try to have physical therapists work with you 2 or 3 times a week for the first 3 weeks and sometime for several weeks. Even the days that the physical therapists are not working with you, we like patients to exercise at least 4 times a day and up to 6 times a day. It's important to work on getting the movement or the flexibility back and getting up frequently, because there's a lower risk of getting a blood clot if you are getting up every 1 to 2 hours. We recommend that you do not walk for longer than 10 minutes at a time, however. This is because if you're walking too much, you have more swelling. And in the first 2 weeks, while your incision is healing, you can have problems with the wound healing. Swelling can also be difficult trying to get back the movement, especially after having a knee replacement. But getting up frequently and walking for short periods of time is encouraged. What activities should I avoid after having surgery? We usually recommend that you avoid bending down and picking things up off of the ground for at least 2 weeks and sometimes for 6 weeks after surgery. This will be uncomfortable, but there's also a small chance, especially with hip replacements, that your hip could move, pop out of place, and dislocate. We would like for you to keep your bandage clean and dry. It should not get wet. It is okay to shower usually after the surgery, as long as you wrap over the bandage with plastic, a garbage bag, tape, or other covering so that your incision does not get wet. We recommend that you avoid strenuous exercise for those that like to exercise. If your wound is healing after the first 2 weeks, your doctor may allow you to participate in riding a bike after the first 2 weeks. Driving is not recommended for 6 weeks after either a knee replacement or a hip replacement. It is best to wait until you regain the movement, flexibility, and strength in your leg. And for most people, 6 weeks after the surgery, they can drive. Intimate relations and sexual intercourse is not recommended in the first 2 weeks while your incision is healing. It is necessary after a hip replacement for 6 weeks to try to avoid positions where you extremely bend your hip and your knee. In the long run, you can do just about any activity after a knee or a hip replacement. The exception, we don't really advise patients to participate in running or jumping after a knee or a hip replacement because it can cause your joint replacement to wear out more quickly. What are some things that I should report to my doctor as being a concern after surgery? Low-grade fevers are very normal. If you should have a fever above 38.5 degrees Celsius, 101.5 degrees Fahrenheit, that could be a sign of an infection, and we would like for you to notify your doctor. If your wound is bleeding or oozing, we expect this in the first 7 days or so after surgery. If it is continuing to bleed or ooze, after 7 days, we would like for you to report this to your doctor. It is not often necessary to clean out and wash out, but sometimes a collection of blood is a problem and we might need to do a minor procedure if your incision is continuing to drain. Urinary infections are not common. You will have a catheter in place after the surgery for no more than 24 hours. It is not common, but you might have a burning sensation when you are trying to urinate or be going to the bathroom very frequently. If this happens, it is advisable to let your doctor know. One of the most serious things and conditions that can happen after a knee or a hip replacement is a blood clot. Usually, after the first 3 days, the pain is improved after knee or hip replacement surgery. If your pain is getting a lot worse, if your leg is becoming a lot more swollen after the 3rd day after the surgery, if you're having any chest pain or trouble with your breathing, it is important to let your doctor know immediately. How often is it necessary to have another surgical procedure after a hip or a knee replacement? Hip replacement surgery requires about 1 to 2% of the time a second surgery to reposition the implants in your hip so that they might not dislocate. Knee replacement surgery, about 10% of the time, you can develop scar tissue and difficulty getting back the movement in your knee. It is sometimes necessary to have you under a very short anesthesia and within 2 minutes to break the scar tissue in your knee. That's called a manipulation of the knee. Sometimes even when you're working very hard with physical therapy, it is still possible that you will have a stiff knee. And so we sometimes do the manipulation under an anesthesia. In the long term, both knee and hip replacements typically work very well. There is a small chance, especially for hips, that the artificial joint may not become solidly bonded with the bone. If that happens, usually within the first 6 months, the pain has not gone away. We rarely do a second surgery to place bigger parts from the hip replacement into your hip. It is not common, but sometimes a knee or a hip replacement can become loose and the position can change. If you're having pain that does not get better or is getting worse, we sometimes will perform a bone scan test to check and see if your knee replacement or hip replacement has become loose. What can I do if I have other questions that you have not answered today? I recommend that you write a list of questions that you can bring to your doctor's visit 30 days to 90 days before the surgery. They may be able to answer many of these questions. If they are unable to do so, it will be my pleasure to answer your questions. We really want you to be educated and have all of your questions answered. We want you to have a wonderful experience with your knee or hip replacement surgery. I am confident that we are bringing the best in the world to Dubai and UAE as part of this program to provide exceptional care to you. And it is my great pleasure to be of service as you go through this process. Thank you very much for your time.